Thank you very much and good afternoon. So this afternoon we'll be sharing the latest updates on our COVID-19 public health response and on vaccine delivery. And while this briefing is about COVID-19 primarily, I would like to start by speaking about influenza for a moment. As I mentioned last week, we've started to see a small number of positive cases of influenza in the community, just 4 so far, so still very low. But it is a marker to us that this virus also circulates and can cause illness. And every person in our province is eligible to get their influenza vaccine free of charge, everybody over 6 months of age, for which we don't have a vaccine yet. And we know that the vaccine is distributed across the province, primarily to pharmacies. They are our partners in delivering the influenza vaccine, and I encourage everybody. Now is the time to get protected from influenza as well, before the holiday season begins. Like COVID-19, influenza vaccine protects you, and it also protects those around you. And we know this is especially important if you are planning on visiting elder relatives or friends over the holidays, or people in your family who have compromised immune systems. We've seen the devastating impacts of COVID-19, and this is compounded if we also have influenza, making people ill as well. Last week in our modelling presentation, I spoke about how our reproductive number, has dropped just below 1. This means the virus is spreading to fewer people. And this can be attributed to the fact that we are reducing our risk across the province by protecting ourselves with immunization. This is encouraging. We've been bouncing around just above 1 and sometimes quite a bit above 1 in some areas of the province for some time, but it is also very precarious. The strain of the virus that is circulating, this Delta strain, and we've seen this around the world now. We look at countries in Europe, the UK, and places in the United States. We know that Delta virus spreads way more easily, and it's that more transmissible and is causing more severe illness, particularly in younger people who did not have very severe illnesses for most of this pandemic. That has changed now, and that has put in a strain on our healthcare system as well. If we're not continuing to do the things that we know work, we can see cases inching up, outbreaks increasing, and hospitalizations increasing. It is especially important for us all to remain vigilant now that we're starting to see other respiratory viruses, that we're going through the peak risk period in the next few months. We can't afford to have gaps in protection. And this pandemic is still very much here, and we see that. We see that with our healthcare system across the province still feeling the strain of the infections that we've had in the past few months and the ones that continue. And healthcare workers are feeling the strain as well. And we're seeing that strain not just from COVID, but also from all of the other conditions that drive people to need health care. Our vaccination rates are inching up, and that is what is going to help us get through these months. The more and more protection we have, we can see this in communities where we have very high immunization rates, and we don't see that rapid transmission and growth of outbreaks. It also means we can do more. We recognize that having these social interactions are so important. The connections are essential to us, and those in-person connections that we've been able to have, we need to keep those going for our own mental health and support of our families and friends. To support this, we have put measures in place to allow for safe social connections, and we've been adapting our public health measures in response to the changing situation that we're seeing with the pandemic. And we've been doing that in different areas of the province based on the risk in those areas. But we have been doing this slowly and incrementally. We've slowly eased restrictions in some areas, on events, on gatherings, but we continue to actively monitor our progress in every area of the province. And we will continue to be cautious in our approach, to monitor as we go, to look at the things like the vaccination rates, the booster doses, and how they're protecting people who are ending up in hospital now. We need to reduce the strain on the hospitals. So here's what I'm asking you to think about as we head towards the upcoming holiday season. Keep your indoor groups small. We know that indoors is more risky than outdoors. And it's really important that if you do have an indoor group, that people are vaccinated. That helps mitigate the risk of transmission. You can spend time with your loved ones, and indeed you must spend time. We need to have that time together. But have a smaller gathering this year, perhaps with 1 or 2 of your family members or your other families, rather than the full big family reunion. And make sure everyone is vaccinated. This is especially important if you have older relatives or people who are going through cancer treatments or have immune system dysfunction. If they're joining you, you need to do more to protect them. And that means making sure everybody who can is vaccinated. If you're wanting to spend time with your broader family and friends, then plan an outdoor activity instead of gathering inside where it's riskier. Go sledding or snowshoeing or hiking. We have many, many wonderful things that we can do outdoors safely, even in the winter months. And if you're traveling to another community, whether for a day trip, for exercise, a holiday getaway, we need you to be a respectful traveler. We know how to do this. We have been through this now together for the last 20 months. We need to continue to be aware of the impact we are having on communities we're going to and the risks that we're bringing with us and, of course, the risks we bring home. And we must recognize that there are some communities right now that are dealing with very serious outbreaks of this virus still, particularly in the north, but also here on Vancouver Island, in the interior, and in some areas of the Lower Mainland. And they may not be ready to accept visitors right now, so check before you go. It also includes following all of the public health orders. Just because things look different in a different community doesn't mean you can let your guard down. Here in BC, respectful travel means being fully vaccinated, using your vaccine card if you're going in to access services or going to events in any community, wearing a mask in all indoor public venues, including local stores, ski hills, all of those areas where we know that extra layer of protection is so important at this time of year as we're moving into respiratory season. Whether there's a vaccine mandate in place or not, it's important for everybody to follow public health orders. That's what will allow us to continue to open things up and to safely gather together. So here are 5 steps I'm asking everybody to take right now. One is get your first or your second dose of vaccine. That's important. And when it's your turn, get your booster dose as well. Get your influenza vaccine to help us get through this season like we did last year without having that additional impact of influenza making people sick. Register your children. We know that the vaccine for 5 to 11-year-olds is being reviewed right now by Health Canada, and we're hopeful that it will be approved very soon, and we can protect the younger ones in our life too. And use your safety basics all the time. We know what we need to do. We need to keep our groups small, stay home and away from others if we're feeling unwell, whether it's COVID or not. Wash your hands regularly. We know that makes a difference. And wearing a mask as an additional layer of protection. I do want to also talk about a little bit of news we have about vaccines. We have been confirmed by the federal government that they have got a limited supply of J&J vaccine that should be coming into the country very soon. And we have not received it yet, but we're expecting to receive some here, a limited amount here in British Columbia, hopefully by early next week. It is a limited amount, and our first priority will be offering it to healthcare workers who have been affected by the PHO order and who want this vaccine as an option for them to continue to safely work in healthcare. So that will be our priority over the next few weeks once this vaccine comes in, and I know that our healthcare teams are working to connect with people who are affected by the order right now. For anyone else, and I know there has been a lot of people who've reached out to me asking for the J&J vaccine, we will have some available, and we will be providing you with the details next week of how you can access this through a central call number. So stay tuned for that. It is a limited amount, but we are hopeful. We've been asking for a number of months, as I know many of you know, for the federal government to bring in some supply of this vaccine that we can use as an option for people here in BC. So we're very grateful it's coming in, and we'll be focusing, as I mentioned, on healthcare workers first, but there will be some available for others who want to use this as an option, and we'll let you know more details next week. Finally, I want to recognize two things. One, that yesterday was the day to honor First Nations, Inuit, and Métis veterans. And I just want to pass on my gratitude for those veterans and for the injustice that many of them felt after serving their country, our country. And with Remembrance Day ahead, let's look to our veterans again, who have shown us how important it is to work together, to support each other, to do our part, and to persevere. And we are persevering. This has been a long pandemic, and it is the time once again for us to remember that we are in this together. We are not all in the same boat, but we are in this storm together, and it is continuing, but we have tools now that will help us get through it. And this next few months are going to be important for us to remember that and to work together. So let's honor and support our active military family and veterans everywhere by continuing to do our part. And let's protect the healthcare workers who are also out there caring for us day in and day out through this long, long storm. Our colleagues, our friends, and our neighbors. And we do this by protecting ourselves and by taking all of those important measures that we know work. So let's protect our veterans this Remembrance Day and continue to be kind to each other, to be calm and compassionate, and to be safe. Thank you.
Thank you very much, Dr. Henry. And on this day, when we've received more information, the monthly report from the coroner about overdose deaths, we want to especially emphasize that we're living in two public health emergencies, that the need to build a comprehensive system of mental health and addictions care in BC is, to say the least, more important than ever. And we're driving to that goal together. But we think of those families, those who have been affected by COVID-19, those that have been affected by the overdose public health emergency. We think and we want to acknowledge their grief and their pain today and commit ourselves to continuing to act in that area. I also wanted to speak about a number of issues and bring updates that we regularly bring on Tuesday. The first is about the healthcare worker mandate, and just to give you some up-to-date numbers and say that it reflects, I think, the significant effort by healthcare workers and the system to ensure that people are safe, that healthcare workers are protected, that patients are protected, that residents of long-term care and assisted living are protected. On the healthcare workers side, since we last reported to members of the media and through you to the public on Friday, we've added 1,548 vaccinated healthcare workers. We're at the beginning of a pay period, so this is additional workers who have worked in the system and they are vaccinated. We've added, I think, in total, and this is a data correction, 30 vaccinated people, so it's been a very significant increase in those vaccinated through the healthcare system. I wanted to just briefly, and I note that by health authority, we're now, if you look at the unvaccinated population, it's 2% across the province, 5% in Interior Health, 4% in Northern Health, 1% in Providence Healthcare, 2% in Provincial Health Services Authority, 1% in the Vancouver Coastal Health Authority, and 2% in the Vancouver Island Health Authority. So this reflects, I think, the very strong vaccination of employees across the system. There's been a lot of interest in looking at the vaccination numbers by job category, and so I'm going to give you two sets of information today. One is that of the 3,071 not vaccinated healthcare workers to whom the order the order applied. That is the order of 2 weeks ago today. 1,032 of those are casuals, 989 are full-time, 819 are part-time, and there are 16 that are not identified. So that gives you a sense of the impact, the FTE impact of the healthcare mandates, vaccine mandates or proof of vaccination mandates. And then by job category, just to give you the job categories that have come together that are over 1,000, so they're not identifying to any group. If you look at allied health, there are 20,379. Often allied health is represented by the Health Sciences Association. There are only 420 unvaccinated people in this category. That's 2%. In emergency medicine and critical care, 1,445 people in the category, 28 not vaccinated, 2%. In general medicine, 5,445 in the category, 105 not vaccinated, that's 2%. Healthcare assistants, that includes those in the communities who have a slightly higher rate of not being vaccinated, and care aides in acute care facilities principally, it's 7,548, of whom 247 are not vaccinated, or 3%. In internal medicine, 1,703. And we'll be providing this to all of you. 19 not vaccinated, or 1%. In nursing, 40,181 nurses, that's registered nurses, LPNs, nurse practitioners, 40,181, 906 not vaccinated, 2%. Paramedics, 2,837. In category, 86 not vaccinated, or 3%. Resident doctors, 1,366 in the province, 10 not vaccinated. And in our specialized surgical units, 1,422 staff, 27 not vaccinated, or 2%. That gives you a sense. The broadest final category is the category of all the others, which includes administration and support staff, people who clean hospitals and so on. They're at 3%. So that's 1,061 of 37,435. In short, the efforts, the number has continued to rise. The percentage of those who are fully vaccinated and partially vaccinated is falling, and not vaccinated has fallen significantly, as you can tell, over the last couple of weeks. And it is our, of course, hope that people will continue to get vaccinated so we can reduce the numbers of people who are on leave of absence without pay or have lost their positions. We can reduce that number as much as possible. Dr. Henry talked about getting the flu shot. That was item number 3 on the list of 5, I think. And just to say that as of November 8th, we know that at least 485,049 doses of influenza vaccine have been administered to British Columbians. We're off to a good start. We also know that the number of doses is actually higher than that. The vast majority of those doses have been delivered by community pharmacy. That number, I believe, is in the neighborhood of 348,381. And so that program is going well, and want to express our appreciation to community pharmacy across BC. We've distributed out through the BC CDC 1.9 million doses to date. We, of course, have more coming, and we're very pleased at the take-up of this campaign. We want to encourage everyone to get their flu shot. And we'll remember, we'll have a test at the end about the other 4 items. So that's positive news. With respect to COVID-19 vaccination, just to note that we're now over 90%. I think it's 90.4% over the age of 12, which is, by any standard in the world, exceptional. That means 4,187,281 dose 1 vaccinations as of last night at midnight. And dose 2, 3,992,679. That's over 86%. And third doses, or booster doses, doses that complete the course, is 181,975. So that number continues to grow as the booster dose campaign continues to address and protect those who are most vulnerable in BC. I note that every care home and every assisted living home in BC has now had its booster dose clinic. So that's important to say. In terms of occupancy in our hospitals, just to put this in context, because as we know, hospitalization is a lag indicator, meaning that when cases start going up, hospitalizations follow some period thereafter. It's the same as cases come down. But we currently have overall in our hospitals, COVID-19 and all other issues, 9,247 people in hospital in BC. And that's based on, approximately 11,500 total beds, base and surge, but 9,229 base beds. So that is over our base bed capacity. In terms of critical care, we have 510 critical care beds in BC, 218 surge beds. We're currently at 478 people in critical care in BC. And obviously, this continues to be a challenging situation. It is why, and I'll be getting to the surgical numbers in a moment, why we continue to manage our healthcare system, to make sure our healthcare workers are able to support people in these very challenging times, and why these actions are necessary, and why we absolutely need more people to get dose 1 and dose 2, and when their time comes, their third dose of a COVID-19 vaccine. Over the last period, as you know, people have been coming down from the Northern Health Authority to other health authorities. That number is now 109, 97 of whom are COVID positive, and the vast majority of those are not vaccinated. And so clearly, that is a heavy price to pay, and we provide the best care in the world to everybody. I am proud of our healthcare workers on Vancouver Island and Fraser Health, in Interior Health, in Vancouver Coastal Health, and of course in Northern Health itself, for the work they're doing on behalf of British Columbians. This is what we do for each other. But what would be better is that the preventable cases, unvaccinated people far from home in critical care, stopped by people getting vaccinated. I want to particularly acknowledge the work of the municipality of Fort St. John and Mayor Laurie Ackerman, who continues to be an outstanding advocate for vaccination in her community. Fort St. John, which used to be well below 60, we can remember those times, and is now at 77% plus and rising. And it's one of the places in BC where vaccination has risen the most, and I appreciate the work of both Mayor Ackerman, community leaders like Dan Davies, and everyone in the community for that. I want to note, in terms of contact tracing, we now have, we've added 20 additional staff to contact tracing this week. We now have 1,595 staff as of November 5th, that is, 2021. And this is higher than the highest level of contact tracing we had during the third wave. That number was 1,563 in the month of May. So we have added contact tracing capacity. Obviously, the number of active cases is significantly less than that, but the importance of the work and the central work that our contact tracing teams do in all of the health authorities continues to be critically important. And finally, I just wanted to talk a little bit about surgeries in our province and surgical renewal. As you know, last week I reported that across BC, most operating rooms continue to run, but due to a variety of challenges, there had been reductions in some operating rooms, and I reported on those in detail last week. The situation remains largely unchanged, but there are developments. Last week in Interior Health, Kelowna General Hospital had reduced 2 operating rooms to compensate for staff who did not meet vaccination requirements and who are on unpaid leave. This week, only 1 operating room has been reduced for this reason. To support critical care, though, Kelowna General Hospital has reduced an additional 2 operating rooms, meaning that it is performing surgeries with 3 fewer operating rooms. Some surgeries continue to be postponed across health authorities as they continue to respond to COVID-19. During the reporting period, October 31st to November 6th, health authorities postponed 288 non-urgent scheduled surgeries. That's 52 in Fraser Health, 16 in Northern Health, 134 in Vancouver Coastal Health, 28 in Vancouver Island Health, and 58 in Interior Health. No surgeries were postponed in the Provincial Health Services Authority. So if you add all of the postponements from September 5th to November 6th, that number is now 2,671. Despite these postponements, surgeries are continuing across the province. From October 17th to October 23rd, health authorities report that 6,960 surgeries were completed. This is 1,029 more surgeries in the same week in 2019, although that week in 2019 included Thanksgiving. For patients who have had their surgeries postponed, and for patients who are waiting for their surgery, this is an especially difficult time. But I hope some measure of comfort is taken from this. We will get you your surgery. We will get you your surgery. Our drive is as strong today as it was in May 2020 when we made our surgical renewal commitment to patients. No matter what challenges we face, we will deliver. We are working as hard as we can, so we can call you as soon as to book your surgery. And it's a message to everybody else. In the time when we're facing and we're approaching respiratory illness season, we're starting it and we're into it, and there are challenges ahead. To get your COVID-19 vaccine, first dose if you haven't got it, to complete it if you haven't yet completed it, to go and get your third dose when you're invited to book, to get your influenza vaccine, and to follow public health orders right now. The December period is an important time of people coming together, and it makes it more important that we follow the guidance and the law that's been set out through public health order in our province. It's important for us. It's important for people waiting for surgery. It's important for our healthcare workers. It's important for your friends, your elders, your community, your children. It's important for everybody that we work together to get this done together in this challenging time.